Go and open your bathroom cabinet for a second and just look at it. The mouthwash in the blue bottle, the one in the green bottle, the whitening rinse, the special gum rinse, the little gadget you bought and used twice. A lot of us have spent a small fortune in that cabinet, and yet somehow, by the end of the day, your mouth still does not feel truly clean, your gums still bleed a little, and your breath comes back before lunch. What if I told you that one simple thing, about a teaspoon of it, dissolved in a glass of warm water, will do more for sore, bleeding gums and stale breath than most of that expensive shelf combined, and that it costs less than $1 and has been in your kitchen the whole time. Now, one thing really, Dr. Hale, one thing done right, and I am going to show you exactly what it is, exactly how much, and exactly how to use it, because the how matters as much as the what. I am Dr. Warren Hale, your neighborhood dentist, and I will tell you something after 30 years chairside. The simplest remedy in all of dentistry is also one of the very oldest and one of the cheapest, and the big companies would much rather you forget it exists. So drop the shame at the door. You did not waste your money because you were foolish. You bought what you were sold. Grab a pen. Here is the one thing and the right way to use it. One quick and honest word before we begin. I am here to teach, not to diagnose you. I am not your dentist, and nothing here replaces a real exam by someone who can look inside your mouth. If your gums are bleeding heavily, painful, swelling, or changing, please see your own dentist, because a rinse is a helper, not a cure for a serious problem. Good? Then let us get into it. So let me not keep you waiting, because the retention rule in my own head says, give you the answer early and then earn it. The one thing is plain salt, ordinary table salt, the cheapest thing in your kitchen, and the recipe is this. Take about half a teaspoon to a full teaspoon of salt, stir it into a good-sized glass of comfortably warm water, warm, not hot, until the salt has completely dissolved. Then take a mouthful and swish it gently around your mouth, and especially hold it over the sore or bleeding areas of your gums for a slow count of about 30 seconds. Then spit it out. Do not swallow it. Do that twice a day, and I would pick right after you brush in the morning and right before bed at night. That is the entire remedy. Under $1 for a container of salt that will last you a year. Now let me earn it, because you should never take a fix on faith, not even from me. Why does something this simple work so well? It comes down to a bit of basic biology, and I will keep it plain. When your gums are inflamed and bleeding, that tissue is swollen, it is puffed up and full of fluid. A warm saltwater rinse is what we call hypertonic, which is a fancy way of saying the water outside the tissue is now saltier than the fluid inside it. And water always tries to move toward the saltier side. So the rinse gently draws that excess fluid out of the swollen gum, which brings the swelling down, eases the tenderness, and lets the tissue settle. On top of that, the salty environment is a hostile one for many of the bacteria that are irritating your gums in the first place, and the warm water soothes and loosens debris, draws down the swelling, discourages the bacteria, soothes the soreness. That is 3 real jobs from 1 teaspoon of salt. This is not folklore. This is why a warm salt rinse has been the standard advice after a tooth extraction for as long as there have been dentists. 2 small details make all the difference. So let me be precise, because people do this wrong and then say it did not work. First, the water must be warm, not hot. Hot water can scald that already tender tissue and make things worse, and cold water simply does not soothe or dissolve the salt as well. Warm, like a comfortable bath. Second, do not rush the swish. A quick 2-second gargle does very little. You want to hold the water and work it slowly and deliberately over the sore areas for a full 30 seconds, letting it sit against the gum line, then spit it out gently rather than forcefully, slow and warm. That is the whole secret to a remedy that is thousands of years old. Let me tell you about a fellow I will call Harold, a retired machinist, because he is the reason I make a point of this. Harold came in convinced something was seriously wrong, because for all his brushing and all the rinses he owned, his gums stayed puffy and his breath embarrassed him at his grandchildren's ball games. He actually brought a bag of his products in to show me 4 different bottles, a rinse for whitening, one for tartar, one for gums, one for fresh breath. I did not scold him. I just handed him a container of salt from the break room and told him to go home and do exactly what I have told you twice a day and add a tongue scraper. 3 weeks later, he called the office, a little sheepish, to say the puffiness was gone and his wife had noticed his breath. 4 bottles beaten by a box of salt. That is not a knock on Harold. That is a knock on the way this stuff is sold to us. Now, your breath, because the title made you a promise and I keep my promises. Here is what most people get wrong about bad breath. They think it comes from the stomach or that they simply need a stronger mouthwash to blast it away. Most of the time, neither is true. The overwhelming majority of everyday bad breath is made right there in the mouth by bacteria that sit on the back of the tongue and down in inflamed gum pockets, breaking down food and giving off sulfur compounds. Those are the smell, so it stands to reason if your gums are inflamed and bleeding, you very often have stale breath riding along with it from the very same bacteria. Quiet the gums with the salt rinse, and you have already gone after one of the 2 sources. Now go after the other, and it costs about $5 one time. A tongue scraper. Most of the bacteria and the smell live on the very back of your tongue in a coating your toothbrush barely touches. Once a day, gently draw a tongue scraper from the back of the tongue forward. A few passes, rinse it, done. People are genuinely shocked at the difference because they have been attacking their breath from the wrong end for years, blasting it with alcohol rinses that only mask it for 20 minutes and then dry the mouth out and make it worse. Let me say a word about why a toothbrush on the tongue is not the same thing, because people tell me they already brush their tongue. A brush pushes the coating around and mashes it into the bristles, but it does not lift it off cleanly the way the flat edge of a scraper does, drawn front to back. Back to front, in one smooth pull. And go gently. You are not sanding a floor, you are skimming a film. If you gag, you are reaching too far back or pressing too hard. Ease off. 2 or 3 light passes. Rinse the scraper under the tap between them, and you are done in 15 seconds. That 15 seconds does more for morning breath than any mint you can buy. And here is the part that connects your breath right back to your gums, which is really the heart of today. Remember those little pockets that form when gums are inflamed and pulling away from the teeth? Food and bacteria collect down in there, out of reach of your brush, and they give off that sour, stale smell all day. This is why a person can brush faithfully and still have breath they are ashamed of. The smell is coming from a place the brush cannot go. The warm salt rinse helps by shrinking that inflamed tissue and flushing the shallow pockets, and cleaning between the teeth every day clears the food out before it can rot. But if the pockets are deep, and only your dentist can measure that, then no rinse reaches the bottom of them. And that is the honest sign that persistent bad breath needs a professional cleaning, not another bottle from the store. Now, some of you are wondering about baking soda because you have heard it mentioned for the mouth. So let me be fair and honest about it. Baking soda dissolved in water does have a real use. It is alkaline, so it can gently neutralize the acid in your mouth after something acidic, and a small pinch stirred into your warm salt water makes a perfectly reasonable rinse that some people find soothing. That much is fine. But here is the caution, and it is a real one, so listen. Do not take dry baking soda and scrub it directly onto your teeth as a paste, day after day, chasing whiter teeth. In that dry, gritty form, it is abrasive and used hard, and often it wears away enamel. And enamel does not grow back, not ever. As a gentle rinse dissolved fully in water, occasionally it is fine. As a daily scrubbing powder, I will not recommend it because I have seen the thinning it causes. Dissolved and gentle, yes. Scrubbed and gritty, no. That brings me to the first honest beat about the products you already own, because I promised you honesty, and it is the whole reason to trust a fellow like me. Be very careful, with the strong, stinging, alcohol-based mouthwashes, the ones that promise to kill millions of germs. For a lot of folks, especially those of us past 60, that alcohol dries the mouth right out. And here is the trap. Saliva is your mouth's own natural defense. It washes away food, it neutralizes acid, it keeps the bacteria in check. A dry mouth actually breeds more of the very bacteria that cause both bleeding gums and bad breath. So the harsh rinse you bought to fix your breath can, for many people, quietly make it worse by the afternoon. That expensive bottle may be working against you. A simple salt rinse and plain water do not have that problem. And let me add the one thing that ties the whole day together, because it is free: water. Plain water, sipped through the day, keeps your saliva flowing, and your saliva is the natural rinse that never stops working, washing food away and carrying minerals back to the teeth between your brushings. So many people past 60 walk around a little dry from the dry indoor air, from not drinking enough, from their medications, and that dryness quietly feeds both bleeding gums and stale breath. You cannot rinse your way out of a dry mouth. Keep a glass of water within reach, sip it, and you give the salt rinse a partner that works all day long. And the second honest beat, which is the most important thing I will say, so hear it clearly. Salt water is a wonderful helper. It is not a cure. If your gums are bleeding because of early inflammation, the rinse, combined with actually cleaning the plaque off the gum line every day with a soft brush and something between the teeth, will calm it beautifully, often within a week or two. But a rinse cannot remove tartar that has already hardened below the gum line, and it cannot fix advanced gum disease where the bone has been lost. If your breath is persistently foul no matter what you do, if your gums bleed heavily for weeks, if a tooth is loose, or if there is a bad taste that will not clear, that is your body telling you to see your dentist, not to buy more salt. There may be hardened tartar or an infection down where you cannot reach, and that genuinely needs a hygienist's tools. There is no shame in that, and there is no rinse on earth that replaces it. One more practical note on the salt itself, since people ask. Any ordinary salt works. Plain table salt is perfectly fine. You do not need a special pink or sea salt, and you do not need to spend a dime more than the cheapest box on the shelf. If you have high blood pressure and you are careful about salt in your diet, do not worry. You are spitting this out, not swallowing it. So a rinse does not add salt to your body the way food does. And do not be tempted to make it saltier than I said, thinking stronger is better. Too much salt just stings the tissue and dries your mouth. Half a teaspoon to a teaspoon in a good glass of warm water is the sweet spot, and more is not better. Simple, cheap, and gentle. That is the whole art of it. Let me put in a plain word about all that money in the cabinet, because I know it stings, and there is a soft lesson in it. So much of what is sold for your mouth is sold on fear and on a pretty bottle. And the office owned by a chain 4 states away is not much different, running its quotas. The humble stuff, the salt, the soft brush, the $5 scraper, the glass of water, nobody makes a fortune on those, so nobody advertises them to you. That does not make them weak. It makes them unpromoted. And you are allowed, always, to ask your own dentist a simple question. Is there a cheaper, simpler version of what you are recommending that would do most of the job? A good dentist will respect you for asking and will tell you the truth. So let us bring it home, simple as I can make it. About a teaspoon of salt in a glass of warm water, swish 30 seconds, twice a day, to draw down the swelling and quiet the bleeding. A $5 tongue scraper, once a day, to clear the real source of stale breath. Plain water through the day to keep your saliva flowing and your mouth defended. And the daily gentle cleaning of the gum line that actually removes the fuel. That whole routine costs you less than a single bottle of the fancy rinse, and it goes after the real cause instead of masking it. And keep seeing your own dentist, because the salt handles the surface, and they handle what is underneath. Next time, I am going to name the 5 everyday foods, Some of them, the ones you think are the healthy choice, that are quietly wearing down your teeth, and I will show you how to keep eating without the damage. It is the natural next step after today. So take care of those teeth and keep it simple and kind. Remember, they are the only set you get, and you are never too old to start saving them. I am Dr. Warren Hale. I will see you next time.